Hello, I'm Dr. Nancy Brock, veterinary anesthesiologist, here with a brief overview of feline laryngospasm, how to prevent it, and what to do if it happens on your watch. Laryngospasm is the reflex closure of the laryngeal opening in response to a variety of triggers, such as direct stimulation of the airway tissues or the accumulation of fluid or secretions around the larynx. Laryngospasm is a serious adverse anesthesia event as it can be life-threatening. We don't know its true incidence in cats, but it is thought to be more common in cats than dogs. And the reason why I'm addressing this topic here as part of anesthesia for healthy cats is that laryngospasm can occur in healthy cats, and it can occur without warning. Since we can't predict when laryngospasm will occur, we should be prepared for it each and every time we anesthetize a cat. This means paying careful attention to how the cat's breathing pattern changes over the course of induction. And if you suddenly hear noise during breathing, or if you note that breathing effort has increased, maybe becoming more abdominal, stop what you're doing, examine the airway immediately, and look for spasm. Because laryngospasm can occur even if we're not attempting to intubate, trying to avoid laryngospasm by just not intubating really doesn't work well as a strategy for mitigating anesthesia risk. I have 4 basic recommendations for how to navigate the risk of laryngospasm. Oxygen delivery by face mask for all awake cats about to undergo induction of anesthesia is my first preemptive step, no exceptions. With proper premedication, cats will accept the mask, although some cats don't really like the feel of the rubber diaphragm against their whiskers, and it helps to simply remove the diaphragm from the mask if at first they resist the mask placement. In the event of airway spasm, pre-oxygenation buys you time to correct the situation before dreaded cyanosis sets in. When laryngospasm occurs, the situation can be very stressful for the anesthetist, and it's tempting to try to just force the endotracheal tube through the arytenoid opening, which I recommend against because of the risk of injury. Certainly if the spasm is only partial and you can visualize a small opening at the bottom of the larynx, by all means, sneak the lubricated beveled tip of the endotracheal tube into that ventral space and gently twist and advance the tube, but you have to be very, very gentle. Placing lidocaine directly on the arytenoid cartilages is my second laryngospasm prevention step, as the lidocaine will quickly numb the mucosa. Allow at least 10 seconds to elapse after placement of the lidocaine before you attempt intubation. I count 10 steamboats or Mississippis in my head to ensure that 10 seconds have gone by. And while I'm counting down my 10 seconds, I reevaluate my patient's depth of anesthesia. If I pinch the cat's toes and I get any kind of pullback, or if I perceive resistance to handling during placement of the topical lidocaine, I administer additional IV induction agent. A specific intubation technique is the third way in which I reduce the risk of laryngospasm. It involves a gentle touch and good visualizing of the arytenoid cartilages. When it comes to seeing what I need to see at intubation, it really helps to be proficient with the use of the laryngoscope. And as I mentioned earlier, I never use force to overcome any resistance to advancing the endotracheal tube. A gentle touch is absolutely key here. Lastly, my 4th recommendation for avoiding laryngospasm in cats is making sure that your feline patients are sufficiently deeply anesthetized. If they're at a light plane of anesthesia, we risk triggering laryngospasm when we go to advance the endotracheal tube. My definition of a patient that's sufficiently asleep for intubation is one that does not pull back when I pinch the front toes and does not move or cough when I place the laryngoscope or the topical lidocaine. I hope that you don't ever encounter laryngospasm, but if you do, try to stay calm and remember that pre-oxygenation has bought you some time. First thing you do is you stop trying to intubate. Next, you place lidocaine on the arytenoids, again, even if you've previously already done so. The third step is to replace the oxygen face mask back on the patient so that you can continue to deliver oxygen. Deepen the plane of anesthesia with additional IV induction drugs. Turn on the vaporizer and wait 20 to 30 seconds before making any further attempts at placing the endotracheal tube. So as I wrap up, let me just summarize what my recommendations are for getting through feline anesthesia without triggering a laryngospasm. Pre-oxygenate all your patients, desensitize their airways, use a laryngoscope, be gentle, and make sure your patients are sufficiently deeply anesthetized before you try to pass the endotracheal tube. Thank you.
I hope you found this video helpful. Please hit the like button and subscribe to our channel.